Welcome to this unit on artificial intelligence in health systems and public health programs. By the end of this unit, you will be able to explain how AI can be used in public health programs. AI in public health programs. AI tools can be designed to support public health programs in a number of ways, including health promotion, disease prevention, health surveillance and emergency preparedness, outbreak response. Concerns about the use of AI in public health programs must be considered before technologies are applied. They include the tension between the benefit of public health surveillance, such as concerns over the use of facial recognition technology in public spaces, ethical and legal concerns about privacy and autonomy for individuals and communities, for example, sharing health information to commercial entities such as insurance companies. Let's start by looking at how AI can be used for health promotion. Health promotion. AI can be used for health promotion to identify target populations or locations with high-risk behavior. Populations that would benefit from health communication and targeted messaging, or micro-targeting, such as those with low levels of health literacy. AI programs can use different forms of data to identify these populations to improve message targeting. Micro-targeting can raise human rights and ethical concerns in terms of commercial and political advertising, and the processes used to facilitate micro-targeting. For example, message recipients may not receive an explanation for why they have been targeted. Micro-targeting may undermine a population's equal access to information. Micro-targeting can also facilitate exclusion or discrimination if it is used improperly. Disease prevention. In terms of disease prevention, AI has been used to address the underlying causes of poor health outcomes, such as risks related to environmental and occupational health. AI tools can be used to improve environmental health in a number of ways. For example, AI tools can detect bacterial contamination in water treatment plants and both simplify the detection process and lower the costs. Sensors to analyze air pollution patterns can improve environmental health. And machine learning can be used to make inferences between the physical environment and healthy behavior. One concern with such use of AI is whether it is provided equitably or if these technologies are only used on behalf of wealthier populations and regions that have the relevant infrastructure for its use. Furthermore, early adopters of AI, such as regional healthcare authorities, could lead some patients having access to its benefits while others will not. This could challenge the human rights principle of equitable access to healthcare of appropriate quality. Surveillance and emergency preparedness. AI has been used in public health surveillance to collect evidence and use it to create mathematical models to inform decision-making. Technology is changing the types of data collected for public health surveillance by the addition of digital traces. Digital traces refers to data that are not generated specifically for public health purposes, such as data from blogs, videos, official reports, and internet searches. The characterization of digital traces as health data raises questions about the type of privacy protection that should be attached to datasets that are not publicly available. For example, the use of digital traces as health data could violate the data protection principle of purpose limitation, that individuals should know what their data will be used for at the point of collection. It also raises questions of accuracy. Models are useful only when appropriate data are used. Machine learning algorithms could be more valuable when augmented by digital traces of human activity. However, digital traces could also negatively impact an algorithm's performance. For example, Google Flu Trends was based on search engine queries about complications, remedies, symptoms, and antiviral medications for influenza, which are used to estimate and predict influenza activity. While Google Flu Trends first provided relatively accurate predictions before those of the US Centers for Disease Control and Prevention, it overestimated the prevalence of flu between 2011 and 2013 because the system was not retrained as human search behavior evolved. Although many public health institutions are not yet making full use of these data, surveillance and health monitoring is changing. For example, by mining disparate online sources and using HealthMap, an online data mining tool, researchers could detect a surge in cases of severe pulmonary disease associated with the use of electronic cigarettes. Similarly, Microsoft researchers have found early evidence of adverse drug reactions from weblogs with an AI system. In 2013, Microsoft's researchers detected side effects of several prescription drugs before they were found by the US Food and Drug Administration's warning system. In 2020, the US Food and Drug Administration sponsored a challenge, soliciting public submissions to develop computation algorithms for automatic detection of adverse events from publicly available data. Despite its potential benefits, real-time data collection, like the collection and use of digital traces, could violate data protection rules if health surveillance was not the stated purpose of its initial collection. This is especially likely when data collection is automated. AI has also been used to assist in both detection and prediction during the COVID-19 pandemic. HealthMap first issued a short bulletin about a new type of pneumonia in Wuhan, China, at the end of December 2019. Since then, AI has been used to assess the current state of the COVID-19 pandemic. In some countries, real-time data on the movement and location of people has been used to build AI models to forecast regional transmission dynamics and guide border checks and surveillance. In order to determine how such applications should be used, an assessment should be conducted of whether they are accurate, effective, useful, and privacy observant. Outbreak response. AI was tested during the 2014 outbreak of Ebola virus disease in West Africa, and the possible uses of AI for different aspects of outbreak response have expanded during the COVID-19 pandemic. They include studying SARS-CoV-2 transmission, facilitating detection, developing possible vaccines and treatments, and understanding the socio-economic impacts of the pandemic. New applications have included proximity tracking applications, which are intended to notify users and possibly health authorities that they have been in the proximity of an individual who tested positive for SARS-CoV-2. There are concerns about privacy and the utility and accuracy of proximity tracking applications. This led WHO to issue interim guidance on the ethical use of proximity tracking applications in 2020. Symptom checkers are intended to guide users through a series of questions to assist in determining whether they should seek medical advice or testing for SARS-CoV-2. The first symptom checkers were hard-coded based on accumulated clinical judgment and on a simple decision support tools. New symptom checkers are based on machine learning to provide advice to patients. The effectiveness of symptom checkers is not yet known, but they do require users to provide accurate information. AI has also been introduced to map the movements of individuals in order to determine the effectiveness of government-mandated orders to remain in confinement, and in some countries to identify individuals who should self-quarantine and be tested. Movement mapping technologies raise legal and ethical concerns about privacy, the risk of discrimination, and the possible unnecessary restriction of movement or access to services, which heavily impact the exercise of a range of human rights. The effectiveness of AI technologies depends on whether the datasets are representative of the populations in which the technologies are used, and without systematic testing and evaluation, their effectiveness remains questionable. The future of artificial intelligence for health. While AI may not replace clinical decision-making, it could improve decisions made by clinicians. Whether AI can advance beyond narrow tasks depends on the trust of providers, patients, and healthcare professionals in AI-based technologies. You have now completed Unit 4 of Module 1, Applications of Artificial Intelligence for Health. Now try the end of module quiz to review what you have learned.